Hello everyone, welcome to Simsot Aesthetics. I am a professional esthetician and cosmetologist. Are you struggling with hair loss? This game-changing mesotherapy treatment regrows hair without surgery. I will give you a complete guide today about procedure, cost, benefits, dermatologists' reviews and more. So subscribe my channel for latest updates. Section 1. What is mesotherapy for hair loss? Mesotherapy is a non-surgical cosmetic procedure that involves injecting a customized cocktail of vitamins, minerals, amino acids, enzymes, and medications directly into the mesoderm, middle layer of the scalp. This technique stimulates hair follicles, improves blood circulation, and promotes hair regrowth. Originally developed in France in 1952 for pain relief, mesotherapy has evolved into a popular hair restoration treatment for conditions like androgenetic alopecia, male and female pattern baldness, alopecia areata, thinning hair due to nutritional deficiencies, stress-related hair loss. Unlike oral medications or topical treatments, mesotherapy delivers nutrients directly to the hair roots, ensuring better absorption and faster results. Section 2. How does mesotherapy work for hair growth? The science behind mesotherapy lies in its direct delivery system. The injected solution contains a blend of active ingredients such as B-complex vitamins, biotin, and vitamin D work to strengthen weak follicles and improve keratin production, the building block of hair. Amino acids like L-cysteine and L-arginine further boost hair protein synthesis, leading to thicker, more resilient strands. For those with hormonal hair loss, androgenetic alopecia, the solution may include minoxidil or finasteride, two proven DHT blockers. DHT is the hormone responsible for shrinking hair follicles in genetic baldness, and these ingredients help counteract its effects. Additionally, hyaluronic acid and growth factors stimulate collagen production, creating a healthier scalp environment for new hair to thrive. Some clinics even enhance the mix with platelet-rich plasma, PRP, which uses the patient's own growth factors to accelerate regeneration. Once injected, these compounds wake up dormant follicles, improve blood circulation to the scalp, and prolong the anagen, growth, phase of the hair cycle. Over time, this leads to reduced shedding, stronger roots, and visible new hair growth, often within just a few months of treatment. It is like giving your scalp a supercharged nutrient boost that topical serums simply cannot match. The key takeaway? Mesotherapy doesn't just mask hair loss. It actively reverses it by addressing the root cause, pun intended, with science-backed ingredients delivered straight to the source. Section 3. Who is a good candidate for mesotherapy? If you're struggling with early to moderate hair thinning, but still have some active hair follicles, mesotherapy could be your solution. It works best for people experiencing excessive shedding, slow growth, or a dry, flaky scalp that's weakening hair health. It's also a great option if topical treatments or oral medications have not given you results. However, mesotherapy won't work on completely bald areas, since it revives existing follicles rather than creating new ones. It's also not safe for pregnant or breastfeeding women, and those with scalp infections or bleeding disorders should avoid it. The best way to know if mesotherapy is right for you? Consult a dermatologist or esthetician. They will examine your scalp and recommend the best treatment plan for your hair loss. Section 4. The mesotherapy procedure, step by step. Here I will guide you about the procedure experience of mesotherapy. Step 1. Consultation and scalp analysis. A specialist examines your scalp using a trichoscope to determine hair density, follicle health, and the extent of hair loss. Step 2. Customized cocktail preparation. Based on your needs, the doctor prepares a nutrient-rich solution tailored to your hair loss type. Step 3. Numbing the scalp, it's optional. A topical anesthetic may be applied to minimize discomfort. Step 4. Injection process. Using a fine needle or mesotherapy gun, the solution is injected 1 to 2 millimeters deep into the scalp in multiple sessions. Step 5. Post-treatment care. Avoid washing hair for 24 hours. Skip intense workouts and sun exposure for 48 hours. Use mild shampoos and avoid chemical treatments. Section 5. How many sessions are needed? For optimal results, mesotherapy requires a two-phase treatment plan. The initial phase consists of 4 to 6 sessions, spaced 1 to 2 weeks apart, to kickstart hair follicle activation. Most patients begin noticing less shedding and thicker hair after just 3 to 4 sessions. However, for long-lasting regrowth, a maintenance phase is crucial. This involves one session every 4 to 6 weeks to sustain results. Full effects, including visible new hair growth, typically appear within 3 to 6 months of consistent treatment. Section 6. Side effects and risks of mesotherapy. While mesotherapy is considered a low-risk hair loss treatment, some patients may experience minor temporary reactions. The most common side effects include mild swelling, redness, or slight bruising at the injection sites, similar to a small bug bite, which typically fades within 24 to 48 hours. You might also feel some temporary tingling or itching as the scalp adjusts to the treatment. In very rare cases, there's a small chance of allergic reactions, if sensitive to any ingredients or infections. Though this only happens with improper, unsterile techniques. That's why it's crucial to always choose a licensed, experienced provider who follows strict hygiene protocols. When performed correctly by a professional, mesotherapy is both safe and effective with minimal downtime. Section 7. Dermatologist Reviews. According to Dr. Emily Sanders, cosmetic dermatologist, mesotherapy is a game-changer for early hair thinning. It delivers targeted nutrients that topical treatments can't. Just ensure you get it done by a certified professional to avoid complications. According to Dr. Raj Patel, hair restoration specialist, NYC, while not a cure for advanced baldness, my patients see reduced shedding and thicker hair in 3 to 4 sessions. Combine it with PRP for enhanced results. Section 8. Mesotherapy versus other hair loss treatments, the quick comparison. Looking for the best hair loss solution? Here's the fast breakdown. Minoxidil, Rogaine, slows shedding but takes 6+ months and requires lifelong use. Finasteride, Propecia, blocks DHT effectively but risks sexual side effects. Both treat symptoms but don't nourish follicles directly. PRP therapy uses your own growth factors for natural regrowth, great but pricey. But best for advanced hair loss. You see and also go for it, but consult first. Hair transplants are permanent but involve surgery, downtime, and high costs. Mesotherapy sits in the sweet spot, no surgery, no daily pills, and no lifelong commitment. It tackles hair loss at the root. Literally, by feeding follicles exactly what they need, whether it's DHT blockers, vitamins, or growth boosters. While it requires multiple sessions, many see less shedding in weeks and fuller hair in months, without the risks of drugs or scalpels. Verdict? If you want a non-surgical, drug-free solution that goes deeper than topical treatments, mesotherapy could be your best bet, especially for early to moderate thinning. Section 9. Mesotherapy cost, is it worth it? The price depends on clinic location and doctor's expertise, number of sessions required. According to latest researches, average cost of mesotherapy for hair loss is $150 to $500 per session, while full treatment of 6 to 8 sessions cost $1,000 to $3,000. While not the cheapest option, mesotherapy is more affordable than hair transplants and offers natural-looking results. Does mesotherapy really work for hair loss? Yes, studies show mesotherapy improves hair density and thickness, especially when combined with PRP or minoxidil. However, results vary based on cause of hair loss, hormonal, nutritional, stress-related. Consistency of sessions. Overall scalp health. Patients report they observed reduced hair shedding in 4 to 8 weeks. New baby hairs in 3 months. Fuller hair in 6 to 12 months. Section 10. Final verdict, should you try mesotherapy? Mesotherapy works best for early-stage hair thinning, slow growth, or deficiency-related loss, stimulating follicles for thicker, healthier hair. However, it won't regrow hair in completely bald areas or treat severe scarring alopecia. For optimal results, combine it with PRP or laser therapy and healthy diet to boost effectiveness. If you're seeking a non-surgical solution for hair loss, mesotherapy could be your answer. Would you try it? Let us know in the comments. Don't forget to like this video and subscribe my channel for more latest beauty advice.